Okay, hello everybody. Welcome to Nursing Home Quality Essentials. We'll wait until it's the top of the hour before we get started. If you'd like, please put your name and the name of your facility where you work into chat. We're excited to have you with us today. Like I said, we'll get started just at the top of the hour. Hopefully, wherever you are right now, you're warm. You'll notice me probably doing this a lot where I'm at. It's pretty chilly. It is the top of the hour now. So again, thank you for coming to Nursing Home Quality Essentials. We'll go to the next slide. So our webinar here is going to be every Tuesday and Thursday from 12 to 12:30 if you're in Central Time Zone. If you're in Colorado, from 11 to 11:30. We'll go to the next slide. Before we begin, make sure that we're in your email contacts. We don't send out a whole lot of stuff, but what we do send out is important, so you want to make sure that you get it. You can also find us on social media. We're on Facebook and LinkedIn. We'll go to the next slide. So our topic for today is, how do you do effective auditing? We're going to talk about planning and conduction tips. We'll go to the next slide. Our objectives, we want to define competency-based training, and then juxtapose that with auditing, and then talk about giving feedback. We want to talk about the reasons for conducting an audit. What are its purposes? We want to describe the steps to plan and then conduct the audit. And then we want to discuss and provide examples of effective feedback. We'll go to the next slide. So if you aren't familiar with Mentimeter, it's something we do to help make these more engaging. You will pull out your smartphone and you'll go to menti.com, or you can just scan this QR code as well, whatever is easier. And then you'll enter in the code to get to this specific room, so to speak. And we're going to do just like an icebreaker fun question to get used to it, and then we'll get started with the real stuff. So I'll give everybody a minute to log on. And that code is 8428-8370. And then that will be at the top of the next slide too. So we'll go to the next slide, or just the icebreaker fun question. What do you think is the country that has the best food in the world? Go ahead and just type the name of the country, hit enter, and then we'll get to see what everybody's responses are. One of the great things about Menti is that it's anonymous. So anytime you're on one of our webinars and you have a comment or a question that you want to make and you're a little bit worried about it, there's no worry needed. Your answers are anonymous. I really like this word cloud tool just because it's more fun to look at visually. Yes. All right, good. So everybody's got kind of a handle on it. We're going to go to the next. Oh, wait, let me, okay, yeah, sorry. I'll go to the next slide. Here's the real stuff. Well, that's okay, we can go. I just thought it would be fun to start out with something easy just to get used to it if you haven't done it yet before. With this, I'm starting a webinar about audits. I wanted to begin with a statistic, and I'd like you all to guess the hand hygiene compliance level in healthcare settings, according to the World Health Organization. What is the compliance when there are not specific improvement interventions in place? Is it 40% compliance? Is it 50%, 60%, or is it 75%? Thank you, Gina and chat. Again, that code is 8428-8370. Okay, so we've got some good answers coming in. We do have primarily a consensus. I'm going to give a couple more seconds, and thank you guys so much for engaging with this and giving your answers. We appreciate it. Okay, so the majority is right. It is 40%. That is kind of shocking. Another, yep. So we wouldn't know these things unless we were doing audits, right? Which is why it's so important. We can talk about, we know the assumption, we give education, we assume everybody knows what to do and how to do it, but unless we're auditing, we don't actually know what that outcome is for compliance. Okay, thank you guys so much. We'll head to the next slide. So we're talking about competency-based training and audit. We're going to head to the next slide. We do a lot of virtual tours, so you may have done this with us before. We do an infection prevention and control tour. It's basically being a second pair of eyes to see, are there any gaps in your program that we can find? And when we do these tours, we ask facilities, what kind of audits are you doing? Now, the response is often that they have skills trainings that are completed quarterly or monthly, right? Skills fairs, competencies. And this is an effective way for providing education and for improving skills. It's important to combine that, though, with observational audits to see if those learned skills are being implemented in everyday practices. So I want to make sure that we distinguish those really, really separately. Both of them do provide an opportunity for feedback to staff members. There are different ways to conduct audits, right? You could do it through observational audits of daily tasks. You can do it through chart reviews or questionnaires or quizzes. I want to touch on competency-based training. Now, this is an approach to education and training that prioritizes the acquiring and demonstration of specific skills and competencies that are needed for a specific job performance. And differentiate that from competency-based checks, which just ensure that the competency is in place. Now, an audit is a process for conducting an objective review of a specific practice. And feedback is providing information about some aspect of a person's task performance that can then be used as a mechanism for modifying behavior where it's needed. We'll go to the next slide. It's just breaking down more about competency-based trainings. Here's where we're assessing what education our staff needs in order to perform a task correctly. There's an instructional design component with this kind of training. We're delivering training based on what we see, and we're assessing compliance with the process and procedure of a task. Competency training aims to build competency where it's lacking. We'll go to the next slide. Now we'll touch on the role of audits briefly here. Why do we do them? We want to have an objective review of specific practices within our homes. We want to measure compliance rates with our standards and with our processes. And we need to have information. We need to have data in order to create improvements. We'll go to the next slide. Now let's touch briefly on what feedback entails. Feedback is providing someone with information about their performance on a task. It's often completed for a specific instance in time, but it can also be covering a longer period of time. It's a mechanism for changing behaviors, both at the individual and organizational level. Next slide. Okay, this is a slide I really like because it just drills down to what differentiates audits from competency checks. A competency check, again, is just simply verifying existing competency. So for audits are obtaining data on real task performance and process gaps. The data is then used to drive your improvement activities, right, through QAPI. They're unannounced. Staff are never going to be aware that an audit or an observation is occurring. This may prompt more than one auditor to collect observations, and not necessarily walking around with the clipboard and an audit sheet in hand. You do want to be more subtle because we want to avoid that phenomenon. When somebody knows that they're being watched, they're going to change their behavior. The observer is going to evaluate the current knowledge and skill in a normal work environment. Feedback is involved in auditing in private after the observation is already complete. Immediate feedback, of course, is going to be given if it's something that could be causing harm to a patient or something that's needed to prevent a future error. Otherwise, feedback should be given privately, maybe the same day or a little bit later on after the observation. And you want to get credit for doing your work. Now, everybody's giving feedback after audits, but make sure that it's written down too, so that if somebody asks, you can show, yes, it's being done and here's the evidence. Finally, the results of audits are used and aggregated to monitor your tracking and your trending, and then used to drive quality improvement. And that's the main point of audits. We want to improve our quality. We want to see where we're at and then where we need to go. Okay, so now let's talk about competency checks. Staff members are aware that this is happening. They're going to be focused on the task at hand, and they're going to be focusing on honing in on the proper technique and the practice. There's training and education involved here. It's usually conducted during scheduled education, like a skills fair, and of course at orientation. And then feedback is provided during the task at hand instead of after. And with the results of competency checks, they're placed in employee files to meet educational requirements, and they're used during surveys to give evidence of your staff competency. All right, we'll go to the next slide. Now we're going to dig in a little bit deeper about the purpose of audits. Next slide. Before we do that, it's another Menti question. So please pull out your phone again. The code is 8428-8370. I want to hear from all of you guys what processes are routinely audited at your facility. So type in, what do you think that you do the most audits on at your home? Lots of hand washing, hand hygiene coming up right away. Yes, you see pericare, excellent PPE. Yes, more hand hygienes, definitely. This validates me using that statistic at the beginning. Nice donning and doffing, yes. Excellent, I see NAR count. Good. Thank you guys so much for your responses. This is awesome. Okay. Yeah, all right, we'll hop over to the next slide. Okay, so why are we doing this? Audits, they take a lot of time, they take a lot of effort. Why? There are so many reasons, right? We are identifying potential risk factors that we can mitigate before they turn into potentially adverse outcomes for residents. We need that data from audits in order to prioritize our improvement projects. They help us see where there are gaps that we need to fill. They're giving us accurate compliance rates, and they're ensuring that our staff are using best practices consistently. And finally, audits allow us to provide really specific and practical feedback. Okay, we'll go to the next slide. These are just some general tips for auditing, right? At the end of the day, all of us are working toward the same goal. It doesn't matter what department you're in. It doesn't matter whether you're floor staff or your leadership. We're all trying to provide the best quality of care to our residents. The more you have staff buy-in, the more participation you have from your staff, the more teamwork, the more collaboration, the more success you're going to see. Any time that you can keep things positive and add fun, you're going to improve your compliance. If you have something that's working really well at your home, to keep that kind of positive, upbeat attitude. If you have anything to help make this more fun, please put that into chat so that we can all learn from each other for best practices. We'll go to the next slide. Okay, so now we'll get more into the nitty-gritty about planning and conducting an audit. Next slide. So these are all the smaller steps that are going to occur during the planning part of the auditing process. First, you're going to select your audit tool. Now, we have an audit tracking workbook that if you aren't familiar with already, please reach out to us. We'd love to tell you about it. It's all digital. It can track several audits over the course of a year. It auto-populates graphs for you based on what your input is. But there are a lot of audit tools out there that are really good and useful. You can find them from the CDC, from WHO, APIC are all great places to find evidence-based infection prevention audit tools. Now, when you're picking your tool, you want to confirm that the tool is going to align with your facility policies. Some of the tools that you find can be edited to make sure that you're able to tailor it specifically to your needs. Next up, method of collecting data. Observational audits, these are the best ways to understand if your staff fully comply with your infection prevention practices, because audit observations are made while they're doing their regular routine. Everything is normal, right? You can complete a paper copy of the audit tool for each staff member observed, which will require data to be keyed into a spreadsheet later. Now, when you're collecting the data, you want to be sure to capture the date. You want to get, of course, the individual's name, also the auditor's name, then the department, unit, and shift on your audit tool. Now, this is a lot. It is. But what it allows you to do then is to analyze that data in greater detail and drill down areas for QA/PI efforts, right? Being able to identify patterns to be able to make a bigger change. And lastly, designate one person to receive the completed audit tools and coordinate data entry. That does not all need to be on the infection preventionist's shoulders. All right, let's go over to frequency. Now, when completing audits, it's important to identify and establish your facility baseline. Now, this gives you the initial data point on how your team can measure improvement. So once you've implemented improvement activities, a weekly audit should be completed. Your team is going to need to determine the frequency so that audits are conducted enough that you can see the impact of those activities. It's important that audits cover all departments, all locations, all shifts, and every day of the week. Next up, audit size. When selecting the auditing size, be sure to be realistic and commit to a weekly sample size that's achievable, but enough to provide useful information. So roughly 10 to 20 staff audits per week should be sufficient for change to be visible when the audit results, the compliance rate, is placed onto a run chart. If your facility's been conducting skills competencies this far rather than performing observational audits, then this is a chance to obtain an accurate compliance rate by conducting a baseline audit that includes most staff. Speaking of that, so when you're selecting auditing staff, this can be clinical and non-clinical staff that are involved in observations. To be thorough, you might also want to consider involving agency staff as well, and not just the facility employees as auditors. Also, when you're selecting your auditors, you want to be sure that they're deemed competent, able to perform the procedure properly that you're auditing. So make sure you're auditing the auditor when it comes to proper hand hygiene, properly donning and doffing. Consider avoiding re-auditing individuals who you've already seen pass an audit, so that your audits are representative of as many staff as possible. And please do re-audit those that originally did not pass an audit to determine if they're now using those skills consistently. One last consideration is to weigh your weekly sample to be representative of your home. So, for example, if your nursing team makes up 60% of all of your staff, then about 60% of your audits each week should be with the nursing staff. And then finally, selecting auditors. The infection preventionist is a person who can be responsible and lead the audits. Others to include, though, would be managers and supervisors of other departments, like social services, maintenance, your director of nursing, your administrator, activities. Those supervisors, they don't necessarily need to only monitor their staff. Maybe have social services monitor nursing and maintenance monitor activities to mix it up. You're going to be doing a lot of audits. Mixing it up can help keep it more interesting and fresh. We'll go to the next slide. So here's where we talk about the conduction part. We're conducting audits now. We're going to first discuss audit standards. So one thing that you need to do is explain to your auditors exactly and precisely, with no questions, what the definition of met means versus not met. For example, met means we're completing a procedure with zero prompting whatsoever, versus not met means you needed any number of prompts. If there is a not met or a no marked on the audit, it means that that specific audit wasn't met. We're going to review each line item in the audit tool and clarify expectations for observation and assessment. If, for example, if it was for hand hygiene, and on the audit tool it states, uses new paper towel to turn off faucet to prevent contamination to clean hands. And the staff member finished scrubbing and goes to turn off the water with their hands, then the auditor should intervene, provide education, document that that audit was not met due to providing a prompt. But they would then still continue with the remaining lines of the audit, and then the audit would go into the pile of not met. Education on auditing behaviors. As we talked about earlier, audits are unannounced, completely unannounced. You want to be sure that your auditors are not notifying staff that they're going to be conducting an observation. Otherwise, this would then be considered a competency check. Auditors should refrain from prompting unless an intervention is necessary to prevent harm or with concern for resident safety. Auditors, they can provide education after the audit, but if they feel uncomfortable with that, they can also resort to the infection preventionist or the designated member who's taking the lead on audits to then provide that feedback. All right, conducting audits. Consider setting aside 1 to 2 weeks for those baseline audits if you have not already done that at your home. Moving on to accuracy and consistency. As the auditor lead, consider auditing your auditors in the early weeks for accuracy and consistency, right? Completing an audit tool for the same individual and then comparing your sheet to the auditor's sheet can be really helpful. It can also be helpful to encourage your auditors to write a quick note as to why something was not met on the audit. Having a little bit more specific information can prove very helpful down the line. You know, that was a lot of information very quickly. Please be typing into chat any questions you have, any comments. We'd like to see it. We'll go to the next slide for now, though. We're going to touch on giving feedback. All right, and then next up, we'll have another Menti question. So this, I just want to get a bead on everybody here, our audience. How are you feeling about giving feedback to staff based on a performance audit? And this is all staff, so floor staff, but also your medical director, department heads. And you're saying like, either I've never done this or I dread doing this on the one side. On the other end is, I don't mind it at all. So most people are feeling really comfortable with it, although as more go in, it's kind of wiggling more toward, I can do it, but it's not my favorite thing. Okay. And sometimes it can feel really awkward to give this feedback too, because everybody knows when you're working in healthcare, everybody is working extremely hard. And we all want to be kind, we all want to be patient, but we also need to make sure people are compliant with infection prevention practices. Okay. So the general consensus of this audience right here who's voting is you feel pretty comfortable, but there is a little bit of wiggle room where you feel like you could feel a little more comfortable. All right, good. Thank you again for participating. I will go to the next slide. There are things that I've heard come up again and again, especially with PPE, and I wanted to share this. This whole resource is wonderful, so please check it out later when you get the slides. But these two especially, I know I've heard a lot. So it can help to have a script available to practice or to use as a template when you get this kind of pushback during your feedback. Some saying, well, I only went into their room for a minute, and helping them remember that when you are in a healthcare environment, um, this can be really contaminated with pathogens, and it only takes 1 second for them to get on your skin, and then one more second for it to pass from your skin to another surface. Making sure that you're underlying the importance of protecting their body and their families' bodies, as well as the residents at the home. Another one that we hear quite a lot is, well, I didn't put things on because it wasn't in the cart. The cart wasn't stocked. I don't have the time to pick it up, which can be valid. So what do you say in that situation? Especially if someone's being very defensive and it feels uncomfortable or awkward. Start off with saying, hey, thank you so much for letting me know about this. Um, I know you're working really hard, and I know it's an imposition when it's not just convenient. Um, we can work together to make this better. Be sure you're asking a person, hey, can you think of a solution for this? Like, what is going to make this better? Um, Also, talk with leadership and make sure everybody knows that they can come to you to ask these things and that there is a sense of psychological safety on staff for everybody to get what they need to do their job. We can head to the next slide. Okay, some feedback strategies. We're providing this after the observation is completed. Um, we're going to have it be in private. We're going to emphasize that the purpose of auditing is constructive, right? Together, we're identifying where a process can be improved. We're going to involve staff in root cause analysis and ask them to share what barriers there are that make it harder for them to perform the process as it's prescribed. For example, in a laundry room, the laundry workers were not wearing masks. And when asked why, they said, it's just too hot. It's unbearably hot with the masks on. So they upped the air conditioning. Suddenly they had better compliance with mask wearing. A lot of times it's just about asking for that root cause of a situation. Um, given the, I know time is coming up. Okay, I want to talk about SBII. So when you're giving feedback, if you want a mechanism to draw back on, you can use this one. S is talking about the situation. You're just going to be specific about when and where you saw the behavior. Next, you're going to talk about that behavior, being really descriptive about what you observed and what you wish to discuss. Next, the impact. We talk about what impact the behavior has on the person doing it, on the residents, on the rest of their team. And then it's important to talk about the intent behind the behavior. Was it something that maybe somebody just forgot? Is there a barrier in place that was preventing them from doing it? We want to practice active listening for this one especially, and emphasizing that mistakes are just a part of learning. It's not a failure of personality. Finally, it's recommended to utilize the teach back method after feedback to make sure that your full message was understood and can be internalized. Something like, okay, now it's time to see how well I did my job of explaining. So tell me what we talked about so I can make sure I'm giving you all the info I'm supposed to. All right, we'll go to the next slide. I want to know, what does your facility do with the audits that you've collected? Go ahead and type your answer into Menti. I'm also going to have my colleague Morgan come off of mic and talk about the webinar for Nursing Home Quality Essentials that she'll be doing in just a bit. Mariah, if you would come off of mic, tell us about your webinar.
Hi, thanks, Tina. Um, Basically, with the webinar coming up in next week on the 17th, we'll just be kind of taking a deeper dive into the next steps after you complete your audits and how we can have effective implementation of intervention. So please feel free to join that next week, and thank you all for coming for today.
Yes. Thank you so much. And I'm looking at these answers. So we're not sure. We're going to make changes. We put it in a binder. New in the role and starting to learn what to do. Going to do root cause analysis to use as a QAPI project. Beautiful. Thank you guys so much. Oh, we've got a compliance team. Awesome. Bro, would you mind going to the next slide? I want to, we'll skip this one just for time factor. We'll go to the next one. We've got some resources for you here. Keep going, Ro. More resources, keep going. If you have questions, please either get a hold of your Telegen, your quality improvement facilitator, or message us. We'll go to the next slide at our email account with any kind of question that pops up, and we will get back to you. Next slide, please. I'm so sorry. I do rehearse these and I'm on time, and then somehow I always just go to the last minute and then some. We've got some great ones coming up. On Tuesday next week, transforming rounds into effective action. Next Thursday, ensuring resident safety. We talk about the facility assessment and COVID-19 preparedness. And then next Tuesday, reducing COVID-19 related pneumonia and talking about vaccine guidelines. Okay, and then next, thank you very much. Thank you for the work that you're doing. It's vitally important and it is hard work. So thank you for what you do. Let us know how we can help support you in it. And then please fill out that questionnaire afterward to let us know how we're doing with this and let us know what you want to be seeing. Thank you so much. Have a wonderful rest of your day and week. Take care.